Hi, I'm Jared Smith Valentine. I'm from Tandem Columbus, and this is for our Gender Affirming Care in Clinical Settings Part 1 training. Now, this first part is going to focus on understanding gender, but we're going to begin by just understanding who I am coming into the room. Again, my name is Jared Smith Valentine. I am a clinical counselor and supervisor and a certified sex therapist. My pronouns are he or they, although honestly, you could use whatever pronouns you'd like to describe me, and as long as you are trying to do so in a respectful manner, I would be happy to reply to those pronouns. I always try to start by acknowledging myself as the context that I am teaching through. And what that means is that I'm always going to be looking at y'all with a lens that has both benefits and limitations based on my experience. In this case, I am white, I am AMAB, I am queer, both gender and sexually queer. You can also use terms like bi or pan, queer romantic. Any of those things work for me. Neuroqueer is probably the most accurate, but that is not language that people use very often. I am married, middle class, non-physically disabled, neurodivergent, I'm hearing and sighted, I'm master's level educated, I'm Appalachian, Midwestern, I'm a great big nerd, all those things. Adjectives you can use to describe me, I am gay, I also use bi because that is also more accurate. Pan is even more accurate. But similar to my pronouns, if you are using something that is in the ballpark of describing my queerness, I'm going to be absolutely happy to engage a conversation as long as your goal is to be respectful. I always try to start with just a little bit about landback.org. So I'm going to start by just naming that where I am filming right now is land that was stolen from the Miami, the Shawandasi, the Tula, the Shawnee, the Shawanaki, the Kaskaskia, and the Hopewell Culture indigenous peoples. Landback is an organization that works to help people who are in indigenous communities by moving towards giving money to them based on the land that we are on. I know it sounds scary. The word land back makes it seem like you would no longer have your house, but at its heart, it is kind of the idea of taking the money that we would ordinarily pay to things like taxes and making sure that that goes to indigenous cultures. So, today's objectives, there are three. Number one, we are going to identify language which is used to describe gender in different communities. Number two, we're going to look at 5 scholarly approaches to how to define and understand gender. And number three, we're going to practice the use of some tools to discuss identity, including the identity constellation, and we'll do a gender descriptive exercise together. Sound good? I know a lot of you are going to be here for CEUs. In order to get CEUs for this presentation, you will need to find the 2 codes that are going to pop up during this presentation. You will have to enter them during your review at the end. If you are here seeking ASECT CEUs, since Tandem is also an ASECT provider, you can use this for areas CKA, CKD, STD, and STF. For just regular counseling social worker MFT in the state of Ohio, we are, through the CSW MFT board, allowed to give 1.5 hours. These hours were determined based on the reasonable amount of time that it would take me to deliver this, you to interpret it, and us to together do the quiz at the end. If you have any questions about that at all, I can be contacted at my email. It is my name, Jared, at tandemcolumbus.com. And so we'll start by just going through today's agenda a little bit. So I want to start with some words to know. So we're going to go through and review different pieces of nomenclature that's going to help you have better, deeper conversations about gender. We're going to then move to, if you take nothing else away from this training. So that is like, hey, if you don't get anything else out of this training, please take these pieces. We're going to review the Plisset model. The Plisset model is not exceptionally geared specifically to gender. It is instead a model of how to discuss sensitive topics in a way that is client-led and client-empowered. We'll do an exercise for defining gender. We're going to review those 5 conceptualizations that are formal. We will also look at some informal gender exercises and some informal gender conceptualizations. We're going to discuss the relationship between gender and sexuality. We will participate in talking about the identity constellation, and then we're going to have a knowledge test at the end. Sound good? Cool. So we're going to start with some words to know, and I'm going to do a little change. There, this feels way more gendery than my last outfit. We're going to start with some words to describe gender. These can be identities or they can be components to understanding identity. The first is an identity, the word trans or transgender. This means having an internal experience of gender that does not match your assigned sex at birth. Next is gender nonconforming. This is the idea of having a gender expression, meaning how you show your gender to other people, that does not fit the gender binary. That kind of brings us into our next NB, or non-binary. So these are people whose gender identity does not most closely align to either of the binary options we think about when we think of gender. We tend to think of it as a male-female choice, but because gender is a spectrum, there are people who fall all over this spectrum. That kind of leads us into gender fluid, the idea that your gender identity and how you gender express, those things can change throughout days, weeks, months, and someone who is gender fluid is someone who notices those changes and reflects those things in their identity and how they express themselves. Queer is an overarching term that stands for people who fall kind of outside the norms. It is also a term that is used kind of as a political joining word for people who are in the LGBTQ community. Andro are people who find themselves aligning in more of an androgynous space, so they like to appear non-gendered. Agender are people who do not feel that they experience gender. There are masc or butch. These are people who tend to have a more masculine, traditionally male gender identity and expression. Femme are people who tend to have a more female or feminine identity and expression. The identity constellation. This is going to be an important concept, so pay attention to this one. The identity constellation is the idea that our gender is made up of all of these different pieces, and that even beyond our gender, we are just a whole bunch of different kind of points, like a constellation. And this is a way of discussing identity in an empowered way that lets you kind of see all of the important bright stars that make up who you are, but also the overall constellation. Gender history. A gender history is something we use when we are in a more clinical headspace to discuss what is it people have noticed about the journey they've been on with their gender over time. Gender euphoria. We talk a lot about gender dysphoria. In fact, we'll talk about that in a few slides, and we'll even mention it next. But gender euphoria is the opposite, the idea of looking at yourself, seeing your gender expression, and feeling authentic in yourself, noticing that you feel aligned and feel correct in your body and in your expression. Gender dysphoria, then, is the opposite. Gender dysphoria obviously is a DSM, is a disorder in the DSM. However, it is more colloquially the experience of seeing yourself or existing in a space where your gender does not match the way that you feel inside, and noticing that distress that is caused by that. The next word is a big one, genitocentrism. Genitocentrism is an idea when discussing sex, gender, equal rights, just in general society, that is weirdly predicated on the reproductive organs that people have in their body. Next, we will talk about the word passing. Passing is the idea of being able to navigate the world in a way where the way you gender express does not set off any alarms to people or cause distress because your gender alignment seems like it is passing what other people's expectations are for you. Now, we may later discuss passing privilege, the idea that when you meet and look like your gender identity and your gender expression intersect in a way that they are similar to your assigned sex at birth, or if you look like it would be your assigned sex at birth, then you tend to have less legal barriers, you tend to have less social barriers. Next is gender affirming care. Gender affirming care is the process of offering health care to help someone find this alignment and this comfort in how they gender identify and gender express. It can be many, 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 many things. And so I could not possibly put everything that falls under gender affirming care in one little category. But I would want you to know that it is everything from social support all the way to medical transition. The next several words I'm going to spell because these are words that we actually don't want to use when we're in a clinical setting. The first is HON. And so this is kind of a colloquialism, especially if you are someone who is Southern or maybe it is just part of a hospitality culture you hold. This can be an easy thing to throw at the end of words as you are connecting to people. However, this word, which, again, derives from the word honey, is not something we want to use because in queer online spaces, HON is kind of used to disparage and offer parallel violence between gender nonconforming people. Um, when I say that, what I mean is that this is an insult that trans and gender nonconforming people use towards each other to say, hey, you are not in the space you are with passing. It is to call into question somebody's ability to pass. So it can make people feel really unsafe to use. The next word is TRANSSEXUAL. And this is just an older word. Now, you will see some people use this word more militantly, especially people who are older and in the queer community, because that is the label that they used. Do not take language from people. So if somebody else uses this word to describe themselves, that is absolutely fine. But when we ask people what their trans experience is, we would not want to put this label on someone who does not self-ascribe it. The next one is considered a slur, and it is TRANNY. Now, this is considered a slur because it has a long history of being a word used to perpetuate and incite and encourage violence against trans people. So do not use this word in your practice, and preferably do not use this word at all. The next is C/D. You might find this online, and this is the idea of cross-dressing or wearing clothes that do not fit your assigned sex at birth. The reason we want to be careful with this word is that this word houses this idea when used in clinical settings. If somebody comes in and I assume that they are cross-dressing and they are trans, that I am really disenfranchising that person and very much reducing their identity. Now, if somebody comes in, similar to the TRANSSEXUAL, if I come in and I use that word to describe me, then it is okay to use that word when describing me, as long as you check in with me. We don't want to take language from our clients. Hey, how would you like me to refer to yourself? I heard you call yourself a cross-dresser. Is that the same language you would like for me to use to refer to you in our notes? Those are the kind of questions we want to ask. Although, something we are going to be building to in part 2 is discussing what goes into the note. And to be honest with you, unless there is a specific reason for a lot of these words to be in there, these are going to be left out of how we describe our notes and how we document in general. Next is the idea of Therianism and kin. Therianism and kin is a newer type of gender expression. Let me pause. I was incorrect there. Therianism and kin is a newer type of identity expression that is non-specific to gender. but it is the idea that people will identify and resonate most with some sort of external to gender creature or experience. So sometimes this will be people who say, hey, I am fairykin, for example. And this would be someone who says that the way they understand their gender in their head is most similarly to the concept that they ascribe to what it would be like to be a fairy. Now, Therianism is just a simple mechanic similar to any of these other experiences, where this is people telling you what their best understanding of them is and how to best respect and understand them and where they are coming from. So if somebody comes in and they are using Therian language to describe themselves, or Therian pronouns, because, I didn't give the example, but someone who identifies as fairykin or feykin may use pronouns fey femme. And we will talk a little bit about neopronouns as we move forward. The important thing being to take away from the idea of Therianism is that if gender is in some ways a performance and it is a system of helping us understand each other and how to interact and respect one another in the world, when somebody shows up with something you're unfamiliar with, we want to make space for that and ask, hey, I heard you use fey and femme as your pronouns. How do I refer to you? What feels respectful and helpful to you? Or I have never heard of somebody who has an experience of Therianism in their gender or in their identity. Can you tell me a little bit more about how you came to understand that and what you would want me to take away from that information? The next piece of information is going to be the idea of the egg and the cracking of the egg. Egg is this idea that when trans people, gender nonconforming people, non-binary people, are sort of experiencing for the first time an awareness that they are in misalignment with their gender, or that there are options for better understanding their experiences, that it's kind of like they've been living in an invisible egg the whole time. And so that leads to the idea of cracking the egg, kind of seeing things kind of fall outside of what is normal for them, and then look and be like, whoa, I guess I've never met a trans person before. That person's experience seems like my experience. Or looking back and saying, hey, the moments that I noticed my egg cracking were these moments that I noticed there were pieces of the way I described myself or the excuses I made where I had to be a certain way. Hey, I was just a tomboy, and that is just who I am as a person. For some people, many people, that would be just the experience they have. Hey, I'm a tomboy, I always have been. But for people who are transgender, gender nonconforming, non-binary, they might have had that same experience and been told they were in that box, and the cracking of the egg is kind of noticing, whoa, hey, I think I was put in this box, but it was not the correct box to describe my experience. As we describe gender, we're going to describe the SOGI. A SOGI is an acronym. It stands for Sexual Orientation, Gender Identity, and Expression, and it is an acronym of kind of a list of things we are going to go through and explore. These next ones I've talked about a little bit already, so I won't spend too much time on them. The first is the idea of gender expression. Gender expression is the way you dress, talk, interact, the things that you do, the ways that you show your gender to people. Gender identity, by contrast, is your internal felt concept of gender. So in your heart, what you feel is your gender. Erotic orientation. Erotic orientation are the contexts that people are sexually attracted to. So whereas sexual identity or sexual orientation is the idea of like, these are the people that I am attracted to, erotic orientation are the things, the places, the contexts that we are attracted to. You will notice that sex and gender are both going to be discussed here. There are many places where sex and gender are entirely separate. But we do live in a society that is impacted by patriarchy, and so while these two things can be very separate experiences, they are also Venn diagrammed at several places. So erotic orientation being context might be, hey, I am into feet. whereas sexual identity might be I am into women's feet. The next I is another acronym, ASAB, you might see, and that is assigned sex at birth. And so that is sometimes also referred to as natal sex, and is the idea that when you are born, on your documentation in the hospital, someone made a call and decided what your sex is, and ergo, because of the way we link sex and gender in our current world, they also kind of determined what gender you would be treated as. Next is intersex, or the idea of the intersex spectrum. Intersex is the oops, sorry, my computer froze. Boom. Intersex is the understanding that there is more than just the medical binary of sex assigned at birth, and that there are people born every day who exist in between these two ends of a spectrum. And so this is sometimes caught at birth because people who are intersex will often have different genital alignments. However, there are many cases where this is not caught until well later in someone's life. For example, people who have congenital adrenal hyperplasia are often not found to be intersex until later in life. We are also in the process of understanding the scope of the intersex spectrum. So depending on who you ask, things like PCOS fall on the intersex spectrum. The next word is transpanic. Transpanic is a legal term that has been used in the past to defend the choice to be violent or murder transgender nonconforming or non-binary people because people they were with were surprised to find out that they had a transgender nonconforming or non-binary identity. This is part of why passing is so valuable to people who are trans, non-binary, and gender non-conforming, because there is an inherent unsafety and an inherent worry that they can be aggressed upon physically in a way that the law has upheld in the past, just because of the bodies that they are waking up and interacting in the world in. Now, this is also why when we talk about documentation later, you will have clients who have a gender diverse experience who will want to understand exactly what you are documenting about them, because there is safety in them having control over who knows what about them. The last word we are going to encounter quite a bit today is social construct. Social construct is just the idea that there are parts of our identity that are the result of the societies we operate in. And so, for example, I am dressed in a cowboy hat right now, and here in Ohio, where I am shooting this would be considered socially strange. Definitely tends to have a masculine energy, and there are a couple bars in Ohio where I could go that would be like cowboy bars where people would not really bat an eye. However, the fact that this outfit is masculine is entirely a social construct, and the fact that it would be weird for me to walk outside in this is also entirely a social construct, right? Because if I lived in a different city in the South, if I lived in Texas, this is, depending on where you are, something you could absolutely walk out and about in and would not receive much pushback from people. That brings us to if you take nothing else away. These are 7 things that if you take nothing else from the presentation today, I want you to walk away understanding these. Number 1, gender-affirming care is empirically supported and endorsed by all major medical and mental health organizations in the United States at this point. Number 2, trans, non-binary, and gender non-conforming folks do not need to receive any intervention to be valid in their identity or for us to respect who they are when they show up in our offices. Number 3, gender affirming care is more than surgery. Number 4, gender affirming care is life-saving care. Number 5, gender affirming care is oppressed in gender minority individuals, but it is something that we allow for gender majority individuals every single day. The next one is that gender affirming care is needed for both adults and children. And the last is that good gender affirming care is never based on the assumption that we need to make someone more male or more female. It is based on the idea that we need to help someone feel more comfortable, and the belief that a person comes in with the wisdom to describe their own experience, and then we get to support them in that experience. An outfit change, and then we'll talk about the implicit model. The outfit changes in this are going to be to center and help you understand that although I may change the way I am gender expressing throughout our presentation, nothing is changing about my gender identity. Like I said earlier, I am a queer person, and in all of these modes of dress, I am a queer person. However, the way that I am expressing and showing to you gender can be very, very different in each of these different outfits. So the implicit is a way that we can have safe conversations with clients about difficult issues, which might include helping them understand or giving them space to help us understand their identity. The implicit comes to us from 1976, Jack Annan, and then it was updated by Sally Davis and Bridget Taylor in 2006 to the explicit model. It's an acronym. The P stands for permission giving, and all it says is that from a top-down perspective, when we are talking to clients about a difficult thing, we're going to start by just giving them permission. So for example, as a sex therapist, I often am like, hey, if you ever have any questions about masturbation, we're absolutely able to talk about them here. After permission giving, a client might come back and want more information. And that's when we would move to the L and the I. So P, permission, LI, limited information. Hey, just so you know, your blood pressure medication can sometimes impact erection. That's an example of limited information. So first I give permission to talk about stuff, and then as we're talking about stuff, if they want to know more, I give limited information. Now, if we continue that conversation and they want more information, that's when we move to the two S's, which stand for specific suggestion. Hey, your partner could use pelvic massage before you have sex to help increase relaxation, and that may reduce pain. So that is an example of giving something specific to try and explaining where and why and how. That is different than just giving a little information or just giving general permission. The last stage of the implicit, the IT, stands for intensive therapy, and that is when you escalate the care. So that might be, hey, let me get you a list of sex therapists, affirmative care clinics, pelvic floor physical therapists, abortion doulas, sexual surrogates, etc. That might be outside of my role or our intensive therapy. Or, because I am a sex therapist, sometimes people come to me to be treated for something unrelated to sex therapy, and as they talk and notice and want to start having conversations about their sexual function, their identity, their sexual role, their kinks, their relationships, whatever falls under the scope of sex therapy, we then move that conversation. And so if we go far enough, my intensive therapy would be, hey, would it be worth us adding, another goal to kind of understand this sexual issue better? And here is why I, as a sex therapist, might be a good person for that. If you would like a totally separate person for that, I would be happy to help you find that. So whereas the implicit model in this slide you will see is a top-down triangle model, the explicit, so the change that was made to the implicit in 2006, is a circular model where permission is always centered. And so what that means is we are just constantly in the stage of coming back to permission. So we will start with giving permission, and then when we get to the need for limited information, I'm going to also give back permission. When we get to specific suggestion, I'm going to also circle back to permission. And when we get to intensive therapy, I'm going to circle back to permission. So it is re-implementing the permissions piece through every stage so that clients have the most control and most autonomy and that their needs are the most centered. I'm going to now move to talking a little bit about what is gender. You'll notice that this is also where we have our first code of the day. So code number 1, you will see on the slide, it is GNDR. Again, code number 1 is GNDR. Just a reminder, if you are taking this course for CEU credit, you will have to have both of those codes at the end in order to receive credit for this, for your time today. So what is gender? And I'm going to give you some interesting ways to think about gender that maybe you have not thought of before. But the first is gender a form of connection? Is it a place that we connect with ourselves and others, right? Certainly, we connect to people along the lines of gender. We expect that maybe people who have a similar gender experience to us might have other things in common with us. And sometimes there are spaces where we feel like we would like to divide along the lines of gender. You know, I remember very clearly being in 4th grade and they have the first talk with you about puberty, right? And what did they do? They split off the students who were males and the students who were females, and it was like a separate little boot camp for puberty. Is gender a form of sexuality? Now, this one, I think most people are going to say no, that gender and sex are different. That is something that we have been really, really driving into people's heads, and I think that in a lot of ways it is true, because gender is distinct from sexuality. But again, gender is tied very deeply to sexuality. So if I am a woman or I am sexualized as a woman, what does that mean? If I am a man and therefore I'm sexualized as a man, what does that mean? What does that mean about my expected role in sex? What does that mean about my expected role in who initiates sex? What sex looks like? Whose responsibility contraception is? What it looks like to have family planning? What the expectations of what it means to be in a relationship are, right? These are all things that are inherently sexual, and ergo we would like to say have nothing to do with gender, but because of the intersection of sex and gender under a patriarchal system, there are absolutely parts of our gender that are sexualized and thus play a big role in our sexuality. The next is gender a form of play? So I think one of the coolest things about gender is that it can be very playful, very whimsical, right? When you are little and we buy, I remember getting my little nieces princess dresses from Disney World, and that was absolutely just a fun experience for them. But it was a gender euphoric experience for them. When you're a little kid, and especially when you're a little girl, for a lot of people, the highest form of gender expression that you can reach is princess, right? Now, that is certainly not everyone's experience of form, but it's an example of how gender can be playful. The way we, either as kiddos or adults, apply makeup can be a form of gender play. If we think back to how kids play and assign roles based on what they might see from parents in the house, this is a way that gender is playful. So is gender play? What if gender is a way that we access the soul or the spirit or the self? What if there is this deep truth that is in us, this divine spark, and gender is the way we acknowledge the most authentic versions of ourselves? Is gender a language? I think it could be, right? We certainly have a lot of language that is specifically gendered. And that also, we see that a lot in marketed projects or products, right? There are a lot of products that change the wording on things or the language that we use. If gender is a language, what is it communicating? I would say it communicates things that feel like universal truths that we need to share with people for them to have an understanding of us. Is gender a set of lifelong developmental milestones? Is gender being born a boy and then When you are a boy, you have to learn to be in leadership roles. You have to learn to enjoy sports. You have to learn to be good at STEM. You have to learn to take care of a dog. You have to grow up and go to, a prom where you have to buy a corsage and you wear a boutonniere. You get married. You have kids. You provide because you are manly and masculine, right? Like, there are a lot of developmental milestones that we tie to gender, whether or not we want to say that that is a part of gender or not. Is gender a part of an identity? I think that's probably one that most people are used to thinking of gender as, is like, hey, this is a part of me that I share with others, and it's crucial to understanding me for people to understand this part of me. Is it a dimension of our health and wellness, right? Can your gender be sick? Can your gender be well? I think there are a lot of people out there who are experiencing illness in their relationship with their gender. I think there are a lot of people who are trying to work towards comfort in their gender, and that's why they would access gender affirming care. And again, that is whether they identify as trans or cis, cisgender being, in this case, the opposite of transgender. So somebody who aligns with their natal sex. Um, you know, if you are a balding man and there's something that feels very virile and masculine about having a full head of hair, then getting a hair transplant is gender affirming care, right? If you are, you know, once you hit 40, if you are a penis owner, that is the percent of people your age who experience erectile dysfunction, and that tends to mimic it all the way up to the time that you are 100. So like 40% of 40-year-olds, 50% of 50-year-olds, and so on and so on and so on. If your gender and your sex intersect at a place that says, I am not a man if I cannot get an erection, there are parts of that that we would work on, because sex is absolutely something that is going to change over time because our bodies change over time. And also, it is something that you would likely go to a doctor to, and they would give you medicine for erectile dysfunction. And that is gender affirming care. Is gender a set of societal roles and expectations? Is gender something that we are responding to, that is just, hey, these are the rules for how to play the game that is being a human being? Uh, I think that that is a part of it as well, right? There are absolutely different lanes that we sort kids into and even adults into, based on our expectation of how they should perform and use gender in their day-to-day life. Is gender a setting in the brain? We have an awful lot of emerging science that says probably, right? That there is a piece of our gender that is something that is fixed, that there is something about us that is programmed to express gender in a certain way. Is gender a means of radical self-acceptance? I would say for a lot of people it is. I would say especially for people who are searching for and finding themselves and going through these, very tedious, very unnecessary often processes. And by unnecessary, I do mean the barriers that are put in place. But these processes that are very tedious to find and be respected in their gender identity, I would have to say that is radical self-acceptance. It is sitting with yourself, noticing the discomfort in that disconnect between who you are supposed to be and who you feel like, and making space for that. And by that same means, I think we can also say that gender is part of a radical act of self-love, right? There is a self-loving radical aspect, and by radical I mean because it is a whole acceptance. It is accepting everything about you, to say, whoa, I am noticing this deep disconnect, and instead of continuing to push that down, I'm going to give myself the space to talk about to talk to whom I need to talk to about what I need to talk about, in order to be comfortable and get to live in my fullest version of myself. Is gender a highly stigmatized and moralized set of expectations? Absolutely. I would say, in my experience, that gender has a high moral value, and that there is a high stigma placed on people who deviate from what is understood to be the gender that they are expected to perform, right? Um, and in fact, we can see that in websites like who'smakingnews.com, right? Where because people who are transgender, nonconforming, and non binary, specifically trans women, are so often accused of grooming children or of, being dangerous to children, there's actually an entire website that its express purpose is to look at whether that is true, and what it finds over and over and over and over and over again is that trans people are not aggressing, on children. They are not aggressing in traditionally gendered spaces. That these are all things being performed by someone outside of the transgender, nonconforming, and non-binary community, and yet. Because we have this stigma and this moral understanding of how you must go through the world with your sex assigned at birth and your gender being in alignment, that we have to find something wrong and something villainous and something evil about trans, non-binary, and gender non-conforming people. Is gender a way humans choose to measure success and ergo failures? Um, I think I see this one a lot, especially in my family. We absolutely have women in my family who will go up to my cousins who are not married, and their question every time is, "When are you going to have kids? Why don't you have kids yet?" Etc. Etc. And this is aggression, right? And this is aggression that is based on, hey, I have set a metric based on your gender that means to me that you have socially succeeded. And if you meet it, then you are a success. And if you do not meet it, then you are a failure. Lastly, is gender a set of beliefs about our internal and external environments? Internal environment meaning the things that we are going on in our head, and external environment meaning the world that we find ourselves in. I think there's a piece of all of these that are true. I think this is the shorthand that I use to help understand gender, is that it is both a set of beliefs and understandings about how I know what is going on in my head, but it is also my understanding of how I, as a human being, need to interact with and express and move throughout society in a way that helps me feel comfortable and understood and respected. Next, we're going to talk about some ways that scholars conceptualize gender. Here's a very different gender expression. My gender has not changed. Again, I am still a queer person. I still ultimately identify as neuroqueer or non-binary, but I would consider this to be a more femme expression. And I want to spend some time talking about ways scholars conceptualize gender. We're going to go through 5 specific theories of gender, and then we'll talk a little more informal. First, there's the structural functional theory of gender. And by first, I just mean that's the one we're going to go through first. This is by Talcott Parsons. Talcott Parsons says that gender roles help keep society organized and functional. Parsons was a believer that men and women have to have distinct skill sets, and that those are ultimately meant to be complementary to each other. He believed that gender roles should be taught as a way to reinforce the family unit. So he believed heavily that either you were following gender roles or you were harming society. This is not a view that is often used in gender roles anymore in the way we can conceptualize them, but when we think about a lot of the pushback that we see from very anti-trans groups, a lot of them still kind of use this functional or this structural functional hierarchy. Next is the social conflict theory of gender. This is actually based on the constructs of Karl Marx, but they were refined to focus on gender by Harriet Martineau. And so Harriet says that gender is a structural system within the patriarchy which distributes power and privilege based on propinquity to masculine gender values. And so what Harriet is saying is that there is this inherent power struggle that exists in gender, and those who can perform masculinity better or fall into masculine spaces have more access to the hierarchy and ergo have more access to power. There's also the symbolic interaction theory of gender. So this was initially the work of George Herbert Mead and then later Max Weber. And it proposes that gender is a set of behaviors enacted by an individual to focus on the individual rather than systemic expression of gender. So Mead and Weber's work would say that it is related to the self, that gender is fully a self concept. Some criticism of this theory is that if gender were solely about self-expression, then there wouldn't be so many systemic components in place. Judith Butler created the deconstructive theory of gender, and that says that gender is less fixed than other models preclude it to be, that gender is in part a performance, that gender is acknowledged as a social construct and as a set of rules, and that given all of this information, we have to then conclude that gender must be both complex and fluid. I am personally moved towards the deconstructive theory of gender, so I enjoy the idea that we acknowledge that gender is both a systemic issue and that gender is also an issue that is individual and performative on some level. I will say, because I'm saying gender is performative while dressed more femme, I think it's important to say that gender expression is part of the performance of gender, but it is not solely the performance of gender, and there is no reason that me wearing makeup inherently makes me, in a more, it certainly is a more femme gender expression, but again, it does not change my gender, it does not change the way that I feel internally. This is all expression as a way to kind of give you something that might be a good, my hope is that at the end of today, you'll be able to look back and be like, oh, yeah, so there's expression and identity, and I was able to see someone's expression change throughout the video while their identity remained the same. The last one we're going to go through is gender schema theory, and this is a Sandra Bem theory, and it says that gender is a set of interpreted data that is categorized by the brain in childhood and is a reaction to our environment. So children are socialized to interpret this behavior, and as gender, they become aware of rewards associated with gender congruent behaviors and punishments associated with gender incongruence. And I do think there's an element of truth in that. I know, for example, when I was little, I always loved, I did love lots of masculine things that were typed masculine, but I also really loved a lot of femme things, and it was very discouraged in my house that I enjoyed those femme things. I remember being very little, and I had a book, I think it was called Tea Time with Francis, and my family would have tea every day, my mom and my grandma, and so tea became a very important part of me, but it also kind of became gendered because my dad was very, very against me owning tea sets or having tea. He was very against me drawing and writing and anything that he felt could be interpreted as femme or girly. And while I don't think that those things, and while I don't think that, the fact that I wasn't allowed to or to like have a tea set or play certain feminine types of games, I certainly don't think that those made me more masculine to be removed from those things. I would also say that I did notice that punitiveness. I did notice, the disallowance of me to be in spaces, or even me getting in trouble, getting yelled at, having my crayons and markers thrown out, right? Those are all things that certainly sent a message. So I think there's a little bit of truth in this schema theory that we do show kids via reward and via punishment gender expectations. Definitely sit for a minute, and I'd love for you to think about which of these theories, if anything, resonate with you either individually or in your work. For me, I find that the deconstructive theory of gender, it makes a lot of space for us to come in as clinicians and say to people, hey, what is it you're noticing makes you uncomfortable? And you get to be in the driver's seat. What would help you feel better? What have you learned through your experience? Um, I want to spend a minute on discussing gender and sexuality. Um, by show of hands in my office, pretty much everyone had been taught that gender and sexuality are different. And my question was, does this resonate with you? Why or why not? And I'll let you hold for that a second. Does it resonate with me that sex and gender are different? And why is this belief system of separation either important or not important? People in my office kind of got sorted into two separate categories. There were people who believed that they were absolutely separate and that they had to be separate, and it was like very deeply ingrained in their political identities or the identities that were politicized upon them, which is that because gender is different than sex, that is part of how we categorically show people that there is no that there is no risk to children, there is no grooming, there is no sexualizing of a child by letting them express their gender identity. And I think that is an interesting point, because what I would say is that gender and sex are separate until they are not. For children, they are largely separate because children are ultimately typically not engaging in sexual behaviors and do not have sexual goals. And when they do, that is unrelated to their gender. That is related to them being victims of sexual assault. But so what I would like for you to hold is that there's different ways we can look at this. So we can look at them as totally separate boxes, and that might be true at certain ages or certain components. I would have a hard time saying that there's no sexuality in gender at any age, because there is this kind of bigger systemic aggression that exists in patriarchy that certainly impacts both adults and children, right? We can look at the rates of kids assigned female at birth and kids assigned male at birth, and we do know that there is more likely to be sexual aggression experienced by kids who were assigned female at birth. Um, what if instead we kind of looked at it as, instead of separate boxes or maybe separate continuums, what if we looked at it as a Venn diagram? Or even as a Venn diagram with the self. So if there was the self and sex and gender as dimensions, right, and all of those things kind of coincide, and that's what kind of gets us closer to this constellation idea. Because if we're Venn diagramming the self and all of these important parts, maybe sexuality and gender are absolutely things that are separate but have some intersection there. Maybe we could also put in just like other immutable self-truths, or our values, our spirit, our soul, other things that make us feel innately linked to our humanity. Or what if we added erotic orientation or sexual, relationship style? If somebody is monogamous versus polyamorous, if someone is sexually interested in men, that's their sexuality, their sexual orientation, their sexual identity. But what about their erotic orientation? Maybe they are into a certain type of man, or maybe they are into men of a certain background. Maybe they are into working men who wear construction hats and safety vests, right? Uh, we can also start to add in things like our cultural identity, our cultural status, our ability status, just the headspaces that we navigate the days in, things like neurodivergence, right? And so when we try to put things in separate boxes, we kind of miss this opportunity to look at, yes, these things are separate parts of the self, but they are all tied together and all tied to the self. And now we get to do a really fun thing where we talked about some formal gender scholarship, but I wanted to provide you with two examples of some informal gender scholarship. And so we will do that now. The first informal gender scholar we used was Shang from Mulan, and we looked at the song I'll Make a Man Out of You. And I think this gives some really good examples of what are and aren't men, based not just on the idea of like biological absolutes, but absolutely some social expectations, right? Men are sons. Men are tranquil as the forest, but have a fire within. I don't think that it is safe to say that there is a biological imperative to be tranquil as a forest, but have a fire within. Uh, Men are centered, as swift as the coursing river. There are some slow men out there, let me tell you. And so I know for a fact that not all men are as swift as the coursing river, and certainly not all of them have all the force of a great typhoon. Um, Men additionally have all the strength of a raging fire. Men are also mysterious as the dark side of the moon. And they're also suited for the rage of war. I think just even things like that, right? As we are talking about, this is definitely has a more levity. It is lighthearted. It is absolutely like a children's movie, but it sends very strong gendered messages. And Mulan is a pretty good study in discussing complexities and intersectionality of gender for a young audience. Men are not daughters in that. They are not spineless. They are unsuited for war. That's heavily implied. And then what? Oh, we lost our. Sorry, had to plug the computer back in. So men are not daughters. They are not spineless. They're not pale, pathetic, or clueless. Um, I come from a long heritage of very pale, very Irish, very Scottish people, including the women. Um, and so, even in this little song, right? And certainly people in, my mom, my grandma, these are people who are very smart, um, who are very strong, who are certainly stand on their values. And even in this little Disney song, there is this implication that if you are not a man, then you must be spineless, pale, pathetic, clueless. And so there's even a little bit of built in of a binary, you must be this or you have to be that, uh, in a way that is very negative and oppressive towards femme people, right? Um, let's move on to our second one. So our second one was Shania Twain. And so when Shania Twain said, "Let's go, girls," did you go? Um, how to feel like a woman, according to Shania Twain, is to be noisy, go totally crazy, forget you're a lady, which does imply that being a lady is different than being a woman. I think lady has like a social hierarchy to it, right? Which kind of adds a level of gender and social hierarchy. Wear men's shirts and short skirts. Go wild in style. Feel the attraction. Color your hair. Check. Uh, do what you dare. I did. The desire to be free makes you a woman. To not need romance. Women do not need romance, according to Shania Twain. They only need to dance. Their hair is down. And the best part is that you have the prerogative to have a little fun. Now, in contrast, things that are less like a woman, or less like a woman, is staying in, being quiet, having inhibitions, being politically correct. Shania Twain specifically says that in order to feel like a woman, you should be politically incorrect. Um, and so I think there's a little dichotomy right there. I would say it's ladylike to be politically correct, but via Shania Twain, potentially not woman. Going wild while not being stylish, needing romance when your hair is up, uh, when you have neglected the prerogative to have a little fun. All of those things are not woman-esque. The goal of this is to see that gender, both in identity and expression, exist in many more words and many more concepts than we are typically spending time with, right? There is this more complex nature to gender on a social level. When we are talking about gender, we are often conflating it with just sex assigned at birth or just these societal roles, but they're all kind of intertwined, like we've been talking. And so I'd like to move you on to a gender descriptive exercise where we can talk a little bit more about what it means to kind of break down the boxes that we put gender in, both for ourselves and for our clients, and talk more broadly about what a gender experience is in that constellation. Um, in this exercise, I'm going to volunteer to share some things about my gender. This I did online a while ago. We got some fabulous responses, so I will share some of those as well. The twist is I'd like you to describe your gender, and feel free to go ahead and write this as you're like listening. But while you write about your gender, I want you to avoid any of the gender descriptive words that you might be used to using. I don't want you to use man, woman, male, female, masculine, feminine, non-binary, gender fluid, androgynous, agender, butch, masc, femme, mother, father, etc., etc. I want you to really challenge yourself to how would you explain your gender without the language that you're used to using to explain your gender. Some ways to start framing this question for yourself is, what is my gender? What pictures are in my head when I think about my gender? What would my gender be shaped like? If my gender had a voice, what kind of things would it say? What does gender feel like in here? What does it feel like other places in my body? And how does my gender make me feel? My gender is furry and stubbly and smells like mountains and pine forests. My gender is named Helper and Protector. My gender is the sinew of muscle, the smell of sweat, the taste of salt. My gender has another side that is shaped like flowing ribbons and roses and winding rivers. Sometimes when you aren't around, my gender leaves, and I'm left in this quiet, peaceful space, existing in my rooms, curated rooms, inclusive rooms, where I can be whomever I want without any assumptions. And then you show back up, and I do my best to cobble together a gender for you, of bits and scraps of who I am and who I'm allowed to be. My gender is heroic and glittery. It's magical. It has nails and beautiful flowers. If my gender had a voice, it would cry out at the pain of being cramped in dusty boxes that it sees other people in. My gender feels like a nature spirit, like an ancestral memory, like an expanding galaxy. My gender makes me feel safe, protected, infinite, and connected. And that's how I understand my gender. I'll give you some examples on this next slide of other people who answered in ways that I found really cool. This person says, my gender is a cave of glistening gemstones of varying colors, lighting a path for those lost. The sound of water drops hitting the cave floor. Another one, my gender is that feeling when a kid is doing something cute on a train and you and a stranger make eye contact and smile, enjoying the moment, and then you go on with your day with just a little more magic. Another one, the soft yellow rays breaking through the forest canopy and a meadow clearing, to the ever-changing star map above my interconnected roots. The feeling of listening to James Taylor albums on vinyl. Here's another. My gender is the same as Schrodinger's cat. It may or may not exist and mostly only meows to the tune of no thank you. Here's someone who doesn't feel connected to the term. I don't feel any connection to the term gender. It's just an empty white void. I think of myself as a fey goblin, but it's not correlated to gender. And the last one, my gender, it feels like warmth of a heavy hug after a difficult day. It smells like sandalwood and lavender and coffee beans, and it sounds like screaming. Um, so these were in response to a prompt that I put up on TikTok. There were well over 1,000 comments, and so if you would like to explore more of these and get some more gender descriptive uh, space, I will make sure to leave up some opportunities to go connect to that URL. This slide also has our second code of the day. Remember, you need both of the codes in order to get credit for this CEU. And so the code for this course is S3LF. That is S as in Sam, the number 3, LF. Awesome, awesome. Let's move on and talk a little bit more about identity constellation. So talking a little bit more about identity constellation, I want you to think who you are, all of the important pieces of you, as a composition of multiple points. The absence of any of these points would change the composition. It would make the shape of your constellation of who you are different. At some points in your life, similar to how stars can burn bright or dim, there might be times that different parts of you feel brighter, more central, more a standout in who you are. And that's okay. We go through different phases, and you can see how ultimately, even as things get brighter or dimmer, there is still this kind of overarching shape that makes up who we are. And the tapestry of all of those unique unique points, that's what forms kind of this unique expression of who we are as people. Another thing I like about this is that it talks a lot about, or implies rather, uh, the word constellation in and of itself is different individually, interpersonally, and culturally, right? Um, the Big Dipper, right, is a big, giant spoon. Individually, I might think it looks uh, less like a spoon and more like the state of Oklahoma. However, uh, many people interpersonally would feel confused if I described it as like, oh, the stars that look like Oklahoma. I would be more interpersonally effective in saying like, oh, yeah, the Big Dipper. However, it's also cultural, right? Because in addition to being the uh, Big Dipper is also Ursa Major, which is a constellation of a bear. And so there's also this cultural component to how we understand that constellation. And that's why gender constellations are a good metaphor and a good way to explore and describe gender, because similarly, gender has individual meaning, it has interpersonal value and communication value interpersonally, and it is deeply impacted by how we express ourselves culturally in the societies we live in. I went ahead and attached pieces of a What Makes You Super form. This is just a form that gives you the opportunity to look at different aspects of both gender, sexuality, and also other pieces of that identity constellation unrelated to those two things that might help you in creating your own identity constellation. The first is gender identity. Hopefully, by this time, we are aware that that is the internal experience of gender. You can see there are different scales here. So you can go from 0 to an absolute on male, female, or other. I will say that the reason that these are three separate scales is I am absolutely, okay, there's no wrong way to fill these out. You can be 100% on male and 100% on female. It does not have to equal up to a specific number. It is all about creating something that you look at that you feel like gives you the ability to show other people how you feel. Gender expression. Um, and, again, there's three different scales. The next is physical attraction. So this is who are you sexually attracted to? And it's going to give three options: male, female, and other genders. Of course, other genders could be expanded in a more perfect form, but for brevity, we just kind of have both extremes, and then we also have sort of an option for other areas in the gamut. Emotional and romantic attraction. So who you feel deeply emotionally connected to, who you want to cuddle with and go on dates with. Uh, I put in primary sex characteristics you might be attracted to. So penis, vagina, other. Um, what I will say about this one is I like to add this in because when people do physical attraction or emotional attraction, sometimes they get hung up on, well, I would only be interested in having sex with someone who has a penis, but I find people who are men to be attracted or to be attractive. And by adding this option, it kind of gives you the ability to be like, yeah, go off, go ahead and select men at 100% if that's where you're feeling it. And then when you get to primary sex characteristics, you can kind of scale those as well. Other in this case might be other parts of the body that you find really attractive. So that could be things uh, like breasts, chests, buttocks. It might be eyes. It might be I get a lot of compliments on being a hairier guy. It might be having a beard or being hairy. It might be a lack of hair. It might be a certain hair color, right? But so those things as well. Boxes for assigned sex at birth. Sometimes I skip this one if I am sitting with a client who is gender diverse, because this can be really activating and we probably already have this information in documentation elsewhere. Relationship style, are you looking for a high commitment in a relationship or low level, and how many partners? And this is where it starts to do some constellation building that is outside of sex and gender. What are your strengths? Um, the what makes you super is borrowed from the concepts of the literature that it's found in, which is my book. It is superhero narrative themed, and so that's why everything kind of has a superhero theming beyond this. But so the next one is like teammates and headquarters. So like, who are the people who are important to you, and what are your places of respite? What are your short-term and long-term goals? Weaknesses, right? In a superhero-y way, that makes sense. We might use growth edges if we're removing the superhero-y context from this. What tools and strategies help you get through the day? What are your values? And then I also left 3 dots for other, but there could be lots of different things we put here. Sometimes I will do something similar to this, and then I'll also go through something like dimensions of wellness, or I'll go through the 4 dimensions of the circle of courage. But this is all just to find those data points that are going to make up the identity constellation. And with that, we can move to our knowledge test. All right, knowledge test time. So again, in order to receive credit, you will have to pass the knowledge test. So I figured let's just go through it together. So passing refers to A, the degree to which a trans non-binary GNC person, gender nonconforming, can safely navigate the world by appearing cisgender following gender-affirming care. B, the ability to pass the test needed to receive gender-affirming care. Or C, a specific type of prosthetic to be inserted in shorts which creates a silhouette of a penis. And the answer there is A. Number 2, gender expression refers to the way a person self-identifies internally, the way in which a person outwardly signals their gender, or a topical gel which is used to provide testosterone. And this one is B, the way in which a person outwardly signals their gender. Number 3, which of these correctly identifies the components of the Plicit model? So there is pause, look interested, share a story, insist on therapy. Permission, that was A. B is permission, limited information, specific suggestion, and intensive treatment. That's B. C is ponder, look up information, show statistics, and isolate themes. The answer to that one is B. Number 4, which of these best describe deconstructive theory? So A, gender is less fixed than other models preclude it to be. Gender is in part a performance. Gender is acknowledged as a social construct and a set of assigned rules. B. Gender is a structural system within the patriarchy which distributes power and privilege. Or C. Gender roles help keep society organized and functioning. That one is A. Next one, number 5. Someone with a symbolic interaction view of gender would most likely agree with which statement? A. Gender is just data categorized by the mind in childhood. B. Gender is complex and fluid. Or C. Gender is a set of behaviors enacted by an individual. The answer there is C. Gender is a set of behaviors enacted by an individual. All right, next page. Number 6. Which of these is one of the scholarly approaches of gender we reviewed today? A. The invisible theory of gender. B. The social conflict theory of gender. Or C. The experiential theory of gender. The answer there is B. The social conflict theory of gender. Number 7. In Mulan's I'll Make a Man Out of You musical number, men are defined by being A. as strong as a sturdy mountain, B. as swift as a soaring eagle, or C. as mysterious as the dark side of the moon. The answer there is C. as mysterious as the dark side of the moon. Number 8. In the gender descriptive exercise, we learn to A. describe our gender experience without the use of common language. B. Identify which gender box we should check on intake paperwork. Or C. Identify areas in which we should change our gender expression. The answer there is A. Number 9, an identity constellation. A. uses your astrology sign to help determine your gender. B. allows you to consider your identity to be a composition of unique points. Or C. forces you to label your identity experience. The answer here is B. Number 10. Gender and sexuality are in two separate boxes that exist in separate spaces. B. are like two parallel lines that never touch. Or C. are like circles where overlap may occur, especially as these concepts relate to ourselves. The answer there is C. What are the codes for part 1 of this training? In case you didn't know, there's a second part of this training that focuses more on documentation and on working with clients who are seeking gender-affirming care. Definitely look out for that training. Feel free to take that one as well. So there were 2 different codes you needed. The first one is GNDR, and the second one is S3LF. The next questions are going to be related to 1 to 10 following statements, or scaling 1 to 10 on a following statement, where 1 is completely disagree and 10 is completely agree. Definitely, these ones aren't ones that I can give you a specific answer to because the answer is up to you, but they are, after attending this course, I am better able to identify language which is used to describe gender in different communities. Number 2, during this course, I was able to review 5 scholarly approaches to understanding gender. And number 3, during this course, I was able to practice the use of tools to discuss identity, including the identity constellation, the descriptive gender exercise, and the What Makes You Super. Awesome. Well, I just want to thank everyone for watching. Hopefully this was interesting and helpful and gave you some new ways to think about and discuss gender with your clients and amongst yourself. If you have any questions, again, you can reach me at jared@tandemcolumbus.com, and I will look really forward to seeing you at the next one.